expect to see a dance party break out in a hospital, but that's exactly what happened here. Thanks to a team of dedicated nurses led by one dedicated nurse who really wanted to celebrate a heart transplant patient. And this morning, that patient, Cristina Morales-Carrillo, shares her journey leading up to this moment and how she's doing today. Good morning, I'm Alexis Del Cid. Welcome back to All Things Heart. A young mom with a heart that didn't always follow the rules. Cristina Morales-Carrillo was born with a heart defect, but it was manageable for most of her life, right up until last summer. That's when it began to fail completely, taking her on a harrowing journey, ultimately ending with a second chance at life.
So I started scrapbooking this year, so I'm still learning how to do it because I'm a beginner of it.
When we first meet 29-year-old Cristina Morales-Carrillo at her home in Topeka, it's just under 3 months since her heart transplant.
And I'm here, thank God I'm here.
She says she feels good physically.
This year.
But the reality of what she survived is just sinking in. She says she sometimes cries at unexpected moments.
It just hits me some here and there. And yesterday, I just start crying. I'm like, why am I crying? I'm fine. I'm alive. Yeah. But it just comes and goes.
There are warm reminders, like the heart-shaped pillow signed by her medical team.
Yes, I try to get them all.
Along with videos of the dance party her nurse Ginger surprised her with. Country girl, shake it for me. When she was recovering in the hospital.
Yeah, I'm like, Ginger, I'm not pretty. I got to do my makeup, I got to do my hair, I'm not even dressed up for that.
At the same time, she also has these pictures and videos. Stark reminders of how close Cristina came to crossing over and leaving her beloved family. A family that includes her husband, adorable little boy, parents, siblings, and dozens of relatives that all live in Topeka. Cristina was born with a heart defect called subvalvular aortic stenosis. The area below her aortic valve was narrow and obstructing the blood flow from her left ventricle to her aorta. Over the next 29 years, Cristina had multiple surgeries and procedures. But in July of 2025, it came to a head. She was at the daycare where she works when she started to feel terrible.
I started having chest pains. I feel weak, and it didn't go away.
She remembers driving herself to the hospital nearby, but after that it's blurry. The next thing she remembers is an ambulance ride to the University of Kansas Health System in Kansas City. This is where doctors broke the news. She needed a new heart.
I was in denial because, I said, I just wanted my own heart to be fixed.
Not only that, but she was so sick she needed to be placed on an ECMO machine to keep her alive. Ultimately, she was removed from ECMO 4 days later because of complications, but luckily she was well enough by then to stay in the hospital off ECMO while she waited for the new heart. She got it on August 30th. By October 3rd, Cristina was home, her new heart filled with gratitude. And her message to anyone else who may be facing something similar one day is simple.
Just have faith. It could be rough, it could be hard, but at the end of the day, you'll make it.
This morning, we are joined by two critical members of Cristina's care team. We have her cardiothoracic surgeon, Dr. Tyler Zorn. Thank you for being here. And one of Cristina's ICU bedside nurses, Ginger Ireland Hoffman. Ginger, you're the brainchild behind the dance party. We're going to get to that part in a moment. And we do have Cristina joining us virtually in Topeka. Her shot is frozen right now, but luckily for Cristina, she looks gorgeous in the shot that's frozen. Sometimes it's frozen on an awkward shot. Look how pretty she looks. We're going to get to Cristina as soon as we get that shot unfrozen. We are so happy to have her joining us. What's it like to see Cristina's story?
Oh man, she's just a special person. Was wonderful to take care of in the hospital the entire time. Always had such a good attitude, even through, very, very challenging moments. And it's always great to see her and great to see her today. Love to hear how she's doing. I
know. Hopefully we'll get that shot unfrozen in a moment because she's so sweet and she has her little heart transplant pillow with her. In addition to the medical care that you provide, Ginger, as a critical care, ICU, cardiothoracic nurse. That's your full official title. It's a mouthful. You're very good at it. How do you also provide that emotional support? I mean, in addition to dance parties that you throw for your patients.
It's the dance parties, really.
Right.
I mean, when we're getting up for the first couple of times, and Dr. Zorn can probably speak to it too, they don't want to get up.
Right.
So we make a dance out of it. It was like, we're going to two-step. It's going to start as a two-step. You're going to hold on to my shoulders because you can't bear weight, and my shoulders are just high enough that you can't push down, and we'll just dance to the chair.
And that's what you do? Mm-hmm. Dr. Zorn, do you two-step?
I think I'm a little too tall. That's what,
Right.
that's my excuse. But no, I don't two-step. But like, you know, there's nothing about what I do that makes my patients want to get up in the morning and walk. There's nothing like an incision, you know, that says get up and walk. You know,
Cracked open a chest and put in a new heart.
Yeah. So we depend on people like Ginger, and it's so great to have her here to talk about it, to really encourage these patients to do what that we all know they can do, but they certainly don't feel like it. So.
We have Cristina back. We have her shot. Cristina, how are you feeling this morning, physically?
I'm good. How are you guys?
Great. It's so good to have you joining us. When we first met you at your house in Topeka, the emotions were so close to the surface. How are you feeling now as you process what happened?
I'm doing well. I'm getting to the point where, okay, you know, it's done. I'm here. I'm sitting there now. I still get a little emotional here and there sometimes, but I'm getting better.
I remember you were sharing with us that when your son found out you needed a new heart, he asked you, "Who broke your heart, Mommy?"
Yes.
How old is your little boy now?
He will be 6 in August.
So sweet. Can you talk about how you finally came out of that denial? You had said you were in denial at first when you heard you needed a new heart. What was going through your mind?
I was terrified. I was scared. Like, I don't want a new heart. I don't want to go through that. It's going to be hard. It's going to be mentally, you know, very hard for me to accept it. But then I talked to the nurse who was with me, and she was explaining me how, you know, it's going to be quick. They're going to get you a new heart. You're going to recover quick. You're young. And so that nurse that was with me and told me that gave me hope. Okay, I can do this. I'm young. I can do it. So that nurse was with me at that time. She made me give more hope.
Before Cristina was put on ECMO, Dr. Zorn, she was very, very sick. ECMO is a form of life support. So what has to be happening or not happening in your heart to be put on ECMO?
Yeah, really it's a last resort for us. You know, it has to be to a point where the heart can't support the needs of the human body. And so there's not enough cardiac output to get to all the cells in her body to allow them to work in a coordinated fashion. And so that's what we saw with her, and that's what we felt like we needed to do to kind of stabilize her and get her through that really acute period. And so luckily she settled down after that, and yeah, and we can talk about kind of what happened next after that.
Well, as we're looking at those pictures of her, Cristina had mentioned something happened with her leg. There was some sort of side effect or complication with her leg. What was that, and is that common?
Yes, so she had, well, I can tell you, there are complications on ECMO that are pretty common. One is bleeding, and then one can be complications with blood flow to the leg that those ECMO cannulas are in, because they're tubes that are in the blood vessels that supply blood flow to the leg, and then they block that flow partially. In her, what was confounding is that it was in the opposite leg that we would expect to see the problem in, where she was most weak. And then also what we saw was kind of profoundly, she had this whole body, what we call rhabdomyolysis, and so really bad muscle breakdown of kind of a lot of the muscles globally in her entire body too, not just in that left leg where it was most profound. And so that's really what drove us to say she needs to come off ECMO, because we're having complications that are too profound to let this continue. And luckily by that time she had we were able to optimize her on some medications and get her to the point where we could kind of keep her stable off that ECMO machine, like we talked, like you saw in the video, to keep her stable until her transplant. So.
Ginger, you're nodding your head yes. How complicated and what are the unique challenges of care this presented to you as her nurse?
So initially, I think that the biggest, catch we had was she was intubated, so she couldn't communicate with me. And I had heard that she was Spanish speaking only, which is absolutely incorrect, as you can see here. But we were lucky enough to have her family at bedside. Her sister, her twin sister, was at the bedside a lot and was super, super helpful. The other piece was with ECMO, they can't really move. Their legs in particular, it's complicated if they move their legs. So trying to talk to her about, you need to keep your legs still. Yes, we can set you up, but your legs can only go at a 30 to 60 degree angle from the rest of your body. And
oh my gosh.
Yeah, she's like, I just want to move. I want to be off my back. And she's just, everybody wants a different position when they sleep.
Now, when you say intubated, that's just for non-medical people. That's a breathing tube.
Breathing tube. Yeah.
So, Cristina, were you conscious and awake with a breathing tube?
No.
Most of the time.
Okay, because I've heard of sometimes that having to be, and you have to be very careful with a patient's hands so they're not tearing at that, which would be so jarring. So when you have to take someone off ECMO, Dr. Zorn, and you're already on the last resort, which is ECMO, how common is that?
It's not uncommon. We use ECMO as a support platform to bridge people to recovery, to treat them through their whatever condition they were going through at the time. And so it's not uncommon for people to come off ECMO. It's just with Cristina, we hadn't corrected the medical abnormality that had driven her to require ECMO in the first place. And so that was the concern. But what we saw is as we got a little bit more fluid off, as we were able to kind of dial in what we call medications to support the heart and help it squeeze, we saw as we came down on ECMO flows, we were able to support her a little bit better than we were when she initially came in shock. And so that's what, that with the complications, we said we needed to get off ECMO support.
Cristina, when we first met you, it was a little bit painful for you to walk. How does it feel now when you walk and move around?
Therapy has helped a lot with my legs, and it feels much better now. I got strength on it. I'm still working on my stairs because I'm still not confident yet, but when I do the stairs, I get a little weak, whichever I still need to practice on and just keep going.
So you're practicing on the stairs, still a little difficult. I wanted to ask you something about the denial part, Ginger. When we touched on it in the story and Cristina talked about it a little bit, you have this, as a nurse, direct window into the emotions. I would imagine more of a direct portal than other members of the care team because you're right there. How do you coach people through denial?
Well, with Cristina in particular, having her family there was super helpful, like I said before, because communicating the message that this is a good thing is where we begin. You're getting a path to be able to have your child with you as they grow up. They're not going to grow up alone. This is a positive thing. You get to be a family for 20, 30, 40 years to come. And convincing her was particularly hard because she's stubborn. Just a little stubborn, right, Cristina?
A little bit.
But she did a great job. Once we got through that, she did a really good job, and she was really working her hardest to get to the day that we had that transplant. And then after transplant, she was working hard to get home.
Right. Did you meet all her family members?
I met most of them, I think.
Well, I guess it'd be really hard to meet all. How many of her family members were you able to meet?
Probably most of them.
Because Cristina told me she has about 200 extended family members in Topeka. You can't fit all those people into a hospital room. Cristina, have you managed to do your rounds and see all of them?
Not yet, but I'm getting there.
Dr. Zorn, how long could Cristina have waited for that heart? How long of a window did she have?
I think she could have waited as long as it took. We knew, she's not the tallest person in the world. So, finding a heart is all about finding a good match. So we didn't need to find a heart that was, you know, a lot of times we need to find a heart that's big enough, and so with her, you know, we could accept a heart that's on the smaller side. So we didn't think it was going to take as long, and so it was always going to be as long as it took, and no matter what that need was, if she, you know, thankfully she didn't need to go back on ECMO, but if that's what it, you know, it would just have been whatever it needed.
You had the tools to keep her alive until this happened.
And I will say, you know, going back to the denial piece, and she wants to keep her own heart. I mean, we also feel that way as well. Whenever we can keep somebody with their native heart and extend that as long as possible, I think it means their overall survival long term is better. And so we looked at it a number of ways. She had already had multiple surgeries. We talked about it. I mean, I probably talked about it with all of my colleagues and beyond about what our options were for just conventional surgeries to go back and look at that valve. But you know, we all came back to it in the end that her heart was too sick, and these operations in the past had been so short-lived that the best thing right now to do was to transplant her and move forward.
You talk about those meetings, and I think a lot of patients are surprised when they realize the sheer number of people that are involved in meeting about their care specifically. So what does that look like? How many people are in that room? How long are those meetings going on? Where are they happening? Because I just always picture one doctor coming in and saying, we have to do this and it has to happen now. And it's completely not like that.
No, it's rarely like that unless it's very straightforward.
Yeah.
But you know, especially our group, I have amazing colleagues, so it kind of happens in two different fronts. Sometimes it just happens in the hallway in the office, you know, where we're sharing complex cases, you know, and just looking through images. And then you know, when we talk about, you know, transplant committees, it's, you know, it's a plethora of people from all different fields that are looking at every angle of a patient and determining, you know, what it's going to take to get that patient to transplant.
We have some questions and some viewer comments coming in that we're going to share in a little bit. If you have a question or a comment that you'd like us to read out loud during the program, you can send it to us right now on YouTube, Facebook, or the All Things Heart email, and you can find those links right here on your screen. Cristina, can you hold up the pillow that you have next to you? Hold it up a little bit more. So, do you sleep with that? Where do you keep that?
No. I keep it safe.
Keep it safe. Tell us about that pillow, Dr. Zorn and Ginger. Is that something that every single heart transplant patient gets?
Well, that might be a record for the most number of signatures on a pillow that I've seen.
Keep holding it up. Wow, look at all those.
It's impressive.
That's really neat.
Yeah, everybody gets one of those pillows. Yeah, every heart transplant and every open heart surgery gets one of those pillows.
Cristina, after you woke up from your transplant, what's the first thing that you remember thinking?
To be honest, I'm alive.
I'm alive.
I was so scared of getting through it. You know, it was a scary process for me. But I kept faith and I made it through it, and just being awake was a blessing.
Yeah. After all that, I'm alive. We want to know more about the dance party, so let's get to the good stuff. Because this is our favorite video ever. Okay, Cristina, this was a big surprise for you that Ginger organized. At what point did you know this was going to happen?
To be honest, I thought she was joking about it. Like, she's not going to do a party for me. I mean, you know, I'm just a girl, normal Latina, and next thing you know, I'm here with the whole group of nurses and people and doctors. I'm like, Ginger, I'm not ready for this. Like, I'm not even dressed or like makeup. My hair's a mess, and I'm in the gown. Like, how dare you do me like that?
Okay, first of all, when we look at that video, you look pretty darn cute. You've got your little braids and your signature red lipstick. You look so happy and adorable. Ginger, how did you know this was something that Cristina would like?
We had a lot of opportunities to chat. I think we were 3 weeks before she got her heart transplant. We had a lot of one-on-one time, and I said, if you could be anywhere else right now, where would you be? I would be dancing. I was like, okay, I'm gonna keep that little nugget and save it for later. And after she was transplanted, and my friend Erin and I were getting her up to the side of the bed, she goes, I don't think I can do this. Yeah, you can. Remember, we're going to have a dance party later. And she's like, we're not going to have a dance party, and we're going to have a dance party. And the dance party ended up being almost 3 weeks after transplant, maybe 4, because I had nursing students that were there with me and loving every minute of hanging out with Cristina and learning about her story and having those moments.
That was my next question is, who are all the people in the video? Are they all nurses? Are they medical students? Who are they?
No, there are nursing students at the N2 level, the N3 level, so second semester nursing students, third semester nursing students. There are nurses from CTI. There are techs from CTI. The nurse manager from Heart Center 9 is in there. A couple of my colleagues from CAIR and Bell IR came up too. So it's a pretty good group. Our tech is in this picture. Right next to her is Jordan. And then her mom, Cristina, is also in the picture.
That's what I was going to ask. Christina's mom's the woman in pink. Dr. Zorn, did you get an invite?
I think
He was
I
in the
may
OR.
have got an invite, but I don't get to come to all these cool things because usually we're just in the operating room.
You're just
at the
doing
time.
just the basic old heart transplant.
But I would like to say one thing. You know, she said she was normal, and I just think you're anything but normal, Cristina, and you are a very special patient. And when you watch those videos, that's incredibly clear, is that you're surrounded by a bunch of people that you've formed relationships over the last month with that are just incredibly happy for your recovery and what you're going through. And so it's always fun to see videos like that, but it's because it's clear there are a bunch of people in that hospital room that really are rooting for you to do well.
How much of a change does that make on the outcome of a patient when they have that kind of support?
I mean,
Look at her.
Yeah.
Yeah. She's shy. Christina's modest and shy.
I'm
She's just a normal girl. And clearly, she's exceptional. So, Dr. Zorn, clearly this isn't a typical situation where you get to see a patient at a dance party.
Yes.
And you don't normally see patients on the other side because you're in the OR and then...
Yeah, and as surgeons, we only usually get one, 3-week, 4-week follow-up, and most of the time they're doing fine. And so the hope is that patients don't come back and see their surgeons that often, because usually it means something's going wrong. And so it's always nice to see people 3 months, 6 months, on this show outside the hospital. When's the best time to see
fun
these?
stuff.
Yes. So it's always incredible to see patients, and great to see Cristina doing so well.
I want to get to some of the viewer questions and the viewer comments, so let's go to those right now. We have our viewer Janet, who writes, Cristina is so young, not even 30. How common is it to do a transplant, a heart transplant, on a woman that's so young?
Not common, and like we say, we try, we do everything we can not to go down the transplant route until it's like ECMO, right? It's a last resort, and so but when you run out of options, this is what you're left with. And so unfortunately, heart disease comes in at all ages. It does happen more commonly in elderly people, but it's not uncommon, as we've seen on this show, and and other times that we are transplanting people young. So
Jenny has a question for you, Cristina. Jenny wants to know what your thoughts are on reaching out to the donor's family, and if you think you'll want to do that.
Oh yes, definitely. I want to get in touch with them as soon as I can. Just to be grateful, because it's nothing easy to lose somebody and give the part to someone else to keep them alive. And just be grateful for them.
Cristina had said she wants to reach out to the donor's family as soon as she can. What's the
usually
timeline?
They do that through our local OPO. It's 6 months to 12 months, something like that. And then our local OPO, which is the organ procurement organization that works in the Kansas City area and beyond, will work with the organ procurement organization from where the donor heart came from.
Got it. And
so they'll kind of be the intermediaries between the donor family and the recipient family, because we always like to give privacy to the donor family, because sometimes it's too hard, or sometimes they don't want to share, and but a lot of times, more than often, the donor family really wants to figure out where this heart went and how it's doing, and especially, I'm sure they would love to hear a story like Christina's, who's doing so well.
Let's see how she's honoring that second chance. When Cristina decides she wants to do that, does she tell you, and then you reach out to the OPO? What steps does she take?
It's usually probably more because she doesn't see me in clinic. It's probably more the heart failure, the heart transplant coordinators that work here at KU that help her get in contact with the organ procurement organization, and it's sending a letter or something like that.
We have a question from June. June has a question for Ginger. She writes, how, Ginger, are you able to form the bonds with your patients, have time to hold a dance party, and be a high-stakes nurse in the ICU when I can barely plan what I'm going to eat for lunch?
By not eating lunch?
Seriously, how do you do that all?
Honestly, we spend 3 12-hour shifts a week, and typically it's with the same patient. So continuity is there, and the relationship starts on day 1. And she was there for several weeks. So we had lots of opportunities to hang out and talk. And, I built relationships with her husband and her sister and her mom, and just being able to communicate. And when somebody else is taking care of her, just stopping by and saying, hey, how are you doing today? Just stopping by to see how things are going. And sometimes we two-step, right, Cristina?
Yes.
You're able to get her up and out. George has one more question, and I'll direct this to you, Dr. Zorn. He wants to know, why are some patients awake on ECMO and other patients are sedated?
We try to get everybody, when we talked about the breathing tube, we try to get everybody extubated, get the breathing tube out, and have everybody awake on ECMO. That can be awake, and so that's having a good mental status, not having a tremendous amount of anxiety, being cooperative with the devices that are in place, because we know that patients are awake and doing exercise and therapy. We'll walk patients on ECMO. We'll stand them, and so the more we can do that before whatever next steps are required, the better patients do. So we tried to keep everybody not sedated on ECMO, but there are reasons that we have to. So,
for today's takeaways, I want to start with Cristina. Cristina, what do you want people watching to know about your journey?
Like that. Don't you keep faith. Like I said, it was hard for me to accept the new heart, and there was denial. But don't you keep faith and keep moving forward, one step at a time. You get there.
1 2-step at a time. Ginger, what about you?
Trust your provider, trust your bedside nurse, and it's going to be okay.
It's going to be okay. I have actually one more question that just came in from Sally. Sally wants to know, can a woman ever get a man's heart or vice versa?
Vice versa, both. I mean,
So,
man can get a woman's heart, women can get a man's heart. It's all about matching size and matching cardiac outputs, and making sure whatever heart you put in somebody, whether it's a mismatch or not, is that it's going to be able to sustain the needs of that recipient that you put it in.
Because we have profiled another heart transplant patient, Robert Frias, who got a teenage girl's heart.
Yes.
And he's doing amazingly.
Yeah.
So, Dr. Zorn, what would you want to say to our viewers and to Cristina?
Well, I mean, I think I've already said it. She's such a special patient, and it's been tremendous to see her journey, as hard as it was, to see that determination bring her to where she is now, and it's great to see her months later, and I'm excited to see her even further beyond just into her journey, and see what that brings for her. But I think today, is a story about relationships and our critical need for the bedside providers and how much they make a difference for our patients. It's not something they get enough credit for, but they truly make all the difference, because, like I said, there's nothing about what I do in that operating room that makes a person want to get up and move the next day, but it really is the relationship and the trust that they build with their bedside team that really makes all the difference.
And Ginger, he's talking about you.
Yeah, something like that, huh?
We wouldn't have
Got to
known
be nice to her every once in a while.
Ginger's amazing. We wouldn't have known
is.
about
Yeah.
this case if you hadn't have thrown the dance party, which led us to you and to Cristina.
The best day ever.
Are you starting to tear up?
Oh, just a little. It was such a good day. It was her longest day standing that day. And I think she went home a week later because PT and OT is really hard.
Yeah.
And the fact that she stood for a full 30 minutes dancing, PT and OT were like, well, we don't have to come see her today.
She got it. Ginger, thank you for everything that you do as a nurse. It's so special, the connection you have. And thank you for your time joining the show. And Cristina, thanks for sharing your journey with all of us. And to our viewers, if you'd like to watch or share any one of our past episodes, just scan the QR code on your screen. It will take you to a list of all of our past episodes. Coming up tomorrow, what started as a sinus infection and unusual exhaustion turned into a life-threatening discovery. That's tomorrow at 8 a.m.